Hi guys, Dr. Sheehan from Oakland Family Dental. Today I'm here to talk to you about 3 reasons why dentures are a bad idea. Stay tuned, I'll be right back. So we're going to start with the most immediate drawbacks of dentures, leading all the way to the long-term complications with them. Okay, one of the most common complaints that we get about dentures is how much plastic there is in their mouth. It can be very difficult to get used to because the roof of the mouth is covered, and so that can, change how somebody speaks. If you like to sing, all of those things take a lot of adjustment. So if you think about a child who wears a retainer, it can take some time before they don't sound a little bit different or the lispy, and because that plastic's covering the roof of the mouth. It's the same idea with the denture, but we have to have it like that. It has to be bulky like that because remember, it's again, it's just plastic, and when you close, you put a lot of force on it, so we don't want it to break. And this is what you have as far as trying to make it like a suction cup to try to keep it up in your mouth. So reason number 2 is functionality. This is something that it's very difficult for me to explain to a patient until they actually already have a denture. We know that the chewing power of a denture is going to be about 1/8 of that of chewing with natural teeth. You have to think about this. Your teeth are in the bone and they kind of stay in place, right? So when you chew up and down, it becomes a lot easier to chew and crunch natural food like, carrots or cucumbers or steak or chicken, anything like that. You can chew because your teeth are moving and actually breaking apart the food. The problem with plastic teeth is that I always joke that they don't actually come together intentionally, they come together by chance, because you have to remember it's sitting just directly on your gums, and so your gums will become pressurized in different areas and it'll rock side by side, and every once in a while the teeth will kind of come together and actually hit, but they're plastic, so they don't have the same strength and the same chewing power like natural teeth do. And with the movement of them on top of that, that really compromises your ability to chew. Dentures are not a good replacement for teeth. I always tell my patients dentures could be a replacement for no teeth, but they really are not a good replacement for teeth. The other thing is, of course, everybody likes to eat. That's embedded in our society, that's embedded in socializing, and that's embedded in celebrating. And if you go out to a restaurant and you have to be looking quickly on the menu about what can you order, what's going to be soft enough that you can chew without anybody noticing that your teeth are moving, what's going to be something easy enough that you can kind of slurp down before all of the glue becomes loose. A lot of patients say they have to run into the bathroom really quick, rinse out their denture, put more glue in, and make it back to the table. And then they just say, well, maybe they don't even want to go out because it's too much work. Over time, you can imagine how that gets to be, a lot of work, and it's very discouraging having to do all of that. So let's jump into reason number 3, and that's bone recession. We've all seen that older looking person who might not actually be that old, but they have that look to their face where their face is starting to shrink in. Maybe their cheeks are falling in a little bit. Their mouth is closing a little bit too much. That's because the bone loss has started to happen, and that's because there's no force that's helping maintain the jaw structure, and they start to get a little bit more wrinkles in the area because they don't have, look at the volume difference from having teeth all the way to having no teeth. Of course the face is going to start to sink in. Of course you're going to start to look older. Of course you're going to have more wrinkles. So the teeth actually use each other to help maintain the bone, and when it's being used, helps make the bone continue to grow, and so it stays strong. So think about this. Have you ever seen somebody who broke their arm or broke their leg and they had to be in a cast for a certain number of weeks? Of course, we all have, right? Once the cast has been removed, what did you see? You saw how the arm or the leg had sort of shrunk. That's because of disuse or disuse atrophy. The same thing happens in the jaw. So when the teeth are taken out, you're not using or putting any pressure in the bone anymore, and the bone starts to deteriorate. So here's a sample. You have teeth. Okay, the teeth are removed, and first you can start to see how the bone immediately starts to shrink. You can see it's getting narrower. It's also getting a lot shorter. This will happen about 40% within 1 year. Now, as the decades continue to go on, the atrophy gets worse and worse. You can see even here, you can see how there's even less bone. It starts to get more and more narrow. And when you try to stick a denture on top of the area when there's less bone, there's even less for it to stick to or grip to. Forget about trying to use any adhesive here, and then you get even to a later stage where the bone has deteriorated quite significantly. If you look here and you see a denture, the problem with the lower denture here is that there's no palate, okay? Of course, we hate the palate because that covers the roof of your mouth and it makes things taste funny and it's bulky and all of that. But the lower, because there's the tongue there, there's no palate, so there's no chance of this staying in. You try to stick some glue on here, and if you have bone atrophy like this, the glue's not gonna work. So I have so many patients who, you know, after, you know, a couple of years of trying this, they don't even wear their lower denture anymore. And so they walk around only with their uppers, because the lower, it hurts. There's nothing for it to stick in there. You can't really chew all that well. I mean, I have a sample here of a patient, and she wore, you know, a denture for a few decades, and you can see how her lower jaw has been disintegrating. The bone needs something to actually keep it in function in order to maintain the bone. So we have you know, if we have our teeth, that's going to maintain the bone. As soon as you stick a denture on that, that's going to start to make the bone continue to disintegrate. You've probably heard that your friend needed to get their denture refitted or realigned. You know what they're adding back? They're going and adding material to the plastic, right? Well, it's not that the denture wore down, it's that the bone wore down. You've been transitioning from one stage to the next stage of this bone atrophy. The refitting is adding in plastic to replace the missing bone. The only way to stop the bone loss is to have force in the area from chewing. That can be stopped by putting implants in, so when you chew on the bone, it's much like having teeth, and that will stop the bone loss. Let's be honest, if you find yourself where you're going to lose all of your teeth and you're thinking about, maybe I should get some dentures, let's make sure that you take into account all of these things that we spoke about today, you know, and the long-term complications and risk factors involved with it. I know it's not easy to think or talk about these things, and I hope this video was helpful. If it was, please like or share our information, and maybe even share it with a friend if you think that this information would help them too. All right, guys, Dr. Amanda Sheehan here again. I'll see you next time.